Everybody, my name is Lauren Sheahan, and for my Apex, I worked with healthTide, and I worked on a project regarding Wisconsin Healthy Kids Meals, specifically in the area of default beverages. So, to give you some background, a default beverage is the beverage automatically included with a child's meal. At many restaurants, soda continues to be the default beverage served with a kid's meal, and this is problematic, especially because we are undergoing an obesity crisis in our country. Soda is adding unnecessary calories to a child's diet, and as the standard drink, this may cause the child to develop a lifelong habit of drinking soda with a meal. Here I'm outlining my project timeline for you guys. I completed my Apex in the summer of 2020. I began with some initial research regarding healthy default beverages, went on to collect community data to gauge local public health interest, and the rest of my time has been spent preparing for the future when we will be pursuing healthy default beverage efforts here in Wisconsin. For the research portion of my project, I focused in on menu defaults and what they are and how they work. I then looked at how menu defaults can benefit the restaurant industry. And finally, I looked into current efforts that are happening nationwide regarding healthy default beverage policies. As I had mentioned, part of my project was collecting data from communities around the state to gauge their interest and capacity in a project related to healthy default beverages. These are the results from that survey. And as you can see, there is a lot of interest in a project regarding healthy default beverages. However, only 25% of respondents had the capacity to move forward with those efforts at the time of the survey. 75% did not. However, the big takeaway from this survey was that 100% of the respondents we surveyed would like to pursue these efforts in the future. With the results of this survey, we concluded a lot of public health professionals have been pulled into COVID-19 efforts, and now may not be the best time to pursue healthy default beverage efforts. However, we will definitely reconvene at a later date. I spent the rest of my time on this project preparing for the future when healthy default beverage efforts can resume in Wisconsin. This is including making new project partners, conducting expert interviews, searching for additional grant opportunities, exploring additional sugar-sweetened beverage strategies, and of course, celebrating when default beverage policies pass across the country. There are many lessons I learned throughout my time working on a healthy default beverage project. First, many public health endeavors take time. Second, flexibility and adaptability is important, and it's especially important when you're working on a project throughout a pandemic. Lastly, there's always preparation work that can be done. Here are my references, and thank you so much for your time.